As the Trump administration ramps up its efforts to combat the opioid epidemic, a congresswoman from Tennessee is tackling the problem with a bill centered on prevention. Here's One America's Hines from Washington.
While opioid and heroin addiction is a treatable disease, fewer than 10% of those who need treatment receive it, according to government statistics. Now, Tennessee Congresswoman Marsha Blackburn has written a bill she hopes will get more people the treatment they need.
One of the things we have learned is that opioid addiction is different from many of the other drug addictions, and that the treatment and the recovery is different. And whether we're working with law enforcement or drug court judges or medical professionals, we're doing our best to keep pace with what they're telling us are the needs, and many times those are changing needs.
So Blackburn's bill, called the Comprehensive Addiction and Recovery Act, or CARA, builds on a previous effort, also called CARA, to establish a 3-day initial prescribing limit on opioids for acute pain, to beef up services to promote recovery, and to increasing the availability of treatment. It would also bolster youth recovery support services and require physicians to use a prescription monitoring program. Ultimately, its aim is to get resources where needed, says Blackburn.
This is to get resources out to families and local communities, law enforcement, recovery efforts, to really begin to provide the education and prevention that is necessary, but also to be able to put a directed process in place for rehab and recovery.
And this is not the first time Blackburn has taken on the issue of addiction. As a Tennessee state senator, she helped initiate a program in that state with a focus on women.
I started working on the drug addiction issue as a state senator in the state, and looking at the establishment of drug courts and how we dealt with women in this process, and putting in place, helping put in place legislation that would allow women to be reunited with their children and receive benefits. There is much of my experience that is informed by that. Just being a mother and a friend, you hear from friends that have people in their family that are affected by addiction.
Whatever the fate of the bill, the need seems acute. The Centers for Disease Control says drug overdoses have surpassed auto accidents as the leading cause of injury-related death. John Hines, One America News, Washington.
We can use your help. Call your cable provider and kindly demand that One America News is added to your lineup. Call today.